is going on, world? What is the deal? Hey, how y'all doing? Hey, I hope y'all had a really good weekend. I hope y'all really had a really good weekend, but you guys already know the deal. Today is Monday. Today's Monday. We ain't going nowhere until I get 100 people in here and I got 1,000 followers. I got 1,000 likes. You know, if I did gain 1,000 followers, that'd be fantastic. Like just right now. But you know, welcome. We're doing NCLEX questions. Appreciate everybody being here. You guys, like I said, you already know the deal. I need 100 people in here. I need 1,000 likes. I need both. If I don't get one, if I get one without the other, hey, it's Black History Month. I do what I want. I'm on vacation. Shout out to everybody. Hey, how was everybody's weekend? I want to know who you are, where you're from, where you're at in your nursing journey. Miss Joy. Oh, Natalie, hold up. Natalie, just Joy. Tell them what happened. Tell them what happened. Hold on. Natalie passed. That's number one. Congratulations, Natalie. Welcome to the greatest shit show on earth, known as nursing. Now, Joy, tell them what happened, Joy. Tell them what happened. What are we doing? Hey, I got 1,000 likes. I need everybody to give, who is it, Natalie? I need everybody to show Natalie love. Show Natalie love right now. Welcome to the greatest shit show on earth. Natalie, if you have a piece of advice to give people for the NCLEX, what would that be? All right. Hey, so we're going to be doing NCLEX questions. Hey, if you passed NCLEX, wherever you are at in your journey, let us know down in the comments. All right. We're trying to foster a good environment down there. Hey, don't come to my chat and troll because I'm going to ban that ass. If y'all don't know, y'all better ask about me. You know what I'm saying? So here we go. Hey, we got 100 folks up in here. Hey, look at that right there. Joy, that's number 2. Miss Joy passed her NCLEX on the 31st. So she actually texted me or emailed me and sent me some stuff and showed me, hey, look, Miss Joy, congratulations to you. Kayla passed on Friday. That's what I'm talking about. That's number 3. Hey, that's 3 people in here. 3 people that passed NCLEX. So I need all of y'all to, while you guys are answering, show every single one of those individuals love. Who is it? Kayla, Natalie, and Miss Joy. Welcome to the greatest shit show on earth, known as being a nurse. If you guys have a piece of advice to give to everybody that's out here, what would that piece of advice be? But until then, ladies and gentlemen, we're doing NCLEX questions. So without further ado, here we go. Ladies and gentlemen, question number 1. Which of the following conditions is linked to more than 50% of clients with abdominal aortic aneurysm? Is it diabetes mellitus, hypertension, peripheral vascular disease, or syphilis? What are we thinking? By the way, I got these questions off nurseslabs.com. No part of me cares if you think that these are easy. The whole point is getting into a rhythm and, getting into a study habit. Bree says, hey, I passed my NCLEX Wednesday. Shout out to you, Bree. Bree, you're number 4. Congratulations. Everybody show Bree love. Tell Bree congratulations. Welcome to the greatest shit show on earth, known as being a nurse. What advice would you give everybody going down the same direction as you when it comes to taking the NCLEX? All right, here we go. Here's our answer. Here is our answer. It's Black History Month, my birthday, and Valentine's Day. Feeling white, single, and old. Stop it. Here we go. Here's our answer in 3, 2, and oops. Lies. Here we go. And the answer is hypertension. Continuous pressure on the vessel walls from hypertension causes the walls to weaken and an aneurysm to occur. The association between hypertension and a AAA could potentially be confounded by other risk factors because hypertension is more common among persons with overweight and obesity, less physical activity, who smoke and have an unhealthy diet. That is part of health promotion and maintenance, which is 6 to 12% on the NCLEX exam. 6 to 12% on the NCLEX exam. Still very important, but it is one of the 8 sections that is important that you need to know for the NCLEX. So shout out to everybody that got that question right. Once again, like I said, I don't care if you think the question is easy. Just shut up and answer it. It says, why does my stomach hurt right now? I don't know. Diarrhea? Like, what you mean? What do you mean? Question number 2. What's up, Ebony? Which of the following sounds is distinctly heard on auscultation over the abdominal region of an abdominal aortic aneurysm client? Is it a bruit, crackles, dullness, or friction rub? What are we thinking? Shout out to everybody that's out here. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes, not only will I boycott the rest of the questions, that's it. I'll just boycott the rest of the questions. I got these questions off nurseslabs.com. Free sets of questions. You guys can go over there and check those out for yourself. If you're a nursing student right now and you haven't shared this live to your cohort in cahoots, I don't know what you're doing with your life, and I need for you to fix yourself. All right. Do that. Share this, like and follow. All right. And also, I want to know who you are, where you're from, and where you were at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? What are you doing here? Here we go. Here's our answer. Here is our answer. Thank you, Nessa, for the share. In 3, 2, and the answer is A. It is a bruit. A bruit, a vascular sound resembling a heart murmur, suggests partial arterial occlusion. In addition to abdominal palpitation, auscultation for abdominal or femoral bruits may be useful for clinical detection of a AAA. Auscultation is performed along the course of the aorta and femoral arteries. However, absence of a bruit does not exclude an aneurysm. That is part of health promotions and maintenance. Sasha says, I just graduated nursing school studying for NCLEX. Shout out to you, Sasha. Hey, 6 to 12% on the NCLEX exam. Remember, with NCLEX, you need content, you need Q&A, you need rationales. What you want to know why is because you need to acquire the knowledge, you need to apply the knowledge, and you need to retain the knowledge. All right. I call that an AAR, an after action report, if anybody, my military folks up in here. All right, here we go. What's up, Tiff? How are you? Question number 3, is a month enough time to study and pass? Probably, Gina. It just depends on how you study. But any 30 to 90 days, no less than 30, no more than 90. Which of the following groups of symptoms indicate a ruptured AAA? Is it a low back pain, increased BP, decreased RBCs, and increased white blood cells? Or is it a severe lower back pain, decreased BP, decreased RBCs, and increased WBCs? Severe lower back pain, decreased BP, decreased RBCs, or decreased white blood cell count? Or is it intermittent low back pain, decreased blood pressure, decreased RBCs, and increased WBCs? What are we thinking? It says, I'm not a nurse, but I own my own practice. You're not a nurse, but you own your own practice and thinking of becoming an MP. So you're not a nurse. Are you a doctor? Wait, I'm confused. I'm confused on that. But anyways, a little bit about me. I've been a nurse for 3.5 years. I've worked in ICU, specifically a burn and a medical ICU. I've worked in PACU and I've worked OR. That's just a little bit about me in my small time as a nurse. I'm a registered nurse and I have my bachelor's degree, if anybody cares about that, because I get asked that question all the time. But of course, I always want to know who you are and where you're from and where you're at in your nursing journey. All right, here we go. Here's our answer in 3, 2, and the answer is B. Severe lower back pain, decreased blood pressure, decreased white blood RBCs, and increased white blood cell count. It says, how is the transition from surge tech to OR nurse? Easy. The only thing that's different in regards is just how the facilities are and, your scope of practice. That's it. Like, you already know what the surgery is all about. You're like, when you become a peri-op nurse, it's everything that you do surgically, but the biggest thing is the level of responsibility and, circulating. And then if you become a scrub nurse, that's even cooler. So a severe low back pain indicates an aneurysm rupture secondary to pressure being applied into the abdominal cavity. When a rupture occurs, the pain is constant because it can't be alleviated until the aneurysm is repaired. Blood pressure decreases due to blood loss or loss of blood. After the aneurysm ruptures, the vasculature is interrupted and blood volume is lost. So blood pressure wouldn't increase for the same reason the RBC count has decreased, not increased. The white blood cell count increases and cells migrate to the site of injury. That is physiological adaptation, which is the third largest section on the NCLEX exam. Third largest section on the NCLEX exam at 11 to 17%. Who said? It says, you are not just an LVN, you are a nurse. Hey, so all of my people, if you're an LVN or an LPN, you are a nurse. It is in the title of I don't care what nobody says. They can say, oh, you're not a real nurse. Well, tell that to the license that you carry as a practical nurse. It says it in your name. Licensed practical nurse, licensed vocational nurse. Hey, tell people to put some respect on your name. However, everybody got to check their ego. You know what I'm saying? Everybody has to check their ego. Nurses include, RNs, LPNs included. All right. That's a big problem in just medicine in general. Here we go. Question number 4. Which of the following complications of an abdominal aortic aneurysm is indicated by detection of a hematoma in the perineal area? Is it a hernia, stage 1 pressure ulcer, retroperitoneal rupture at the repair site, or rapid expansion of the aneurysm? What are we thinking? Angel says, so glad I came across you doing a live again. Angel, if you follow me and you subscribe and you hit those notifications, ma'am, you would know all the time when I'm up here. So shout out to hey, so something else about me. I was in the Navy for 16 years. I actually got out last month. I was a hospital corpsman, surge tech. I was a master instructor in the Navy. So I've been an educator for the last 9 years. Love every bit of it, which is exactly why I do this on TikTok. So I appreciate everybody being here and listening to me run my mouth and try to, get y'all that knowledge. All right, here we go. Here's our answer. Here's our answer in 3, 2. And the answer is C, retroperitoneal rupture at the repair site. Blood collects at the retroperitoneal space and is exhibited as a hematoma in the perineal area. This rupture is most commonly caused by leakage at the repair site. That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. It's actually the 4th largest section when it comes to the client needs. There are 8 client needs, and the first 4 make up more than half than the exam. Your subscription star is not on the screen. I don't have a subscription star. I'm actually doing some other type of subscription off of TikTok. So that trust and believe me, when we do NCLEX, we're going to be doing it over there, and we're going to do it off TikTok because, TikTok likes to, ban people and put them in timeout, and sometimes I just don't work well with that. Here we go. Question number 5. Which hereditary disease is most commonly linked to an aneurysm? Is it cystic fibrosis? Is it lupus? Is it Marfan syndrome or myocardial infarction? What are we thinking? OF, OnlyFans? You wish I had an OnlyFans. Hell, I wish I had an OnlyFans. This isn't about me. There were a few girls I worked with that did have an OnlyFans, but this isn't about me or them. This is about y'all and answering these questions. So what y'all think? Oh my goodness. Hey, by the way, if you're in nursing school and you haven't shared this to anybody, what are you thinking? What are you thinking? By the way, if I don't have 10,000 likes by the time I get to 10 questions, I'm stopping it. I'm stopping these questions. You better ask somebody because they know I'll do it. They know I'll do it. So you better make it happen. Here we go, y'all. Here's our answer. Everybody screaming C. Got some B's out there. Okay, here we go. Here's our answer in 3, 2. And the answer is C. It's Marfan syndrome. Marfan syndrome results in the degeneration of the elastic fibers of the aortic media. Therefore, clients with the syndrome are more likely to develop an aortic aneurysm. Marfan syndrome, or MFS, is a spectrum of disorder caused by a hereditable genetic defect of connective tissue that has an autosomal dominant mode of transmission. That is physiological adaptation. Physiological adaptation, which is the 3rd largest section on the NCLEX at 11 to 17%. All right. So, hey, if you've never heard of it, this is where you get to do the research. Remember how I said something about content, Q&A, rationale. Then if you don't understand it, guess what? That ass is going right back to the beginning, and you're going to find the content so you know exactly what it is. That way, when the question comes up, it's not so foreign to you. Ladies and gentlemen, hey, I got some test taking tips for you guys. I've actually had people message me and say, hey, I love your test taking guide. It helped me out and it helped me pass. Hey, whatever I got to do to help you pass, that's what I do. Test taking tips to conquer the NCLEX. You want to know why? Because it begins with you. You can check that link up in my bio up here somewhere, or you guys can go to thebootnurse.com/test and get you that form. 42 pages of just buttery, delicious goodness. I don't even know why I just said it like that, but y'all already know what's up. Here we go. Question number 6, which of the following treatments is the definitive one for a ruptured aneurysm? Is it antihypertensive medication administration, arteriogram? Is it beta blocker administration, or is it surgical intervention? What are we thinking? I had somebody message me, by the way, y'all, and they were just like, there's no way. He said, there's no way that you would ever see this type of question on NCLEX. Now, for somebody who said they've taken the NCLEX once, that's to me, that's kind of, just, out of pocket that you say something wild like that. But the NCLEX has a very wide test bank. And if you're not doing well, you very well could see questions of this caliber on your exam. I'm just saying. So, y'all know how I like to check people. You literally have to prepare for anything. Exactly. I literally have to check people, and y'all know I enjoy checking people. So here we go. Here's our answer. Here is our answer in 3, 2, and the answer is D, surgical intervention. When the vessel ruptures, surgery is the only intervention that can repair it. The technique used for aneurysm surgery have for long been standardized. 95% of aneurysms are accessible via a small, a frontal temporal craniotomy centered over the pterion. What is only occasional cases, principally, oh my God, aneurysms of the distal anterior cranial artery, oh my God, artery and the lower vertebrobasilar trunk. Lord have mercy, require different surgical interventions. Physiological adaptation. Obviously, your boy don't know how to talk today. I've been recording content all day, so forgive my stutteriness. But physiological adaptation, 11 to 17% on the NCLEX exam. Are you stroking out? Man, I hope that I would never stroke out like in front of anybody on TikTok. Like that would be terrible. But 11 to 17% on the NCLEX. All right. Third largest section. Here we go. Question number 7. Which of the following heart muscle diseases is unrelated to other cardiovascular diseases? Is it cardiomyopathy, coronary artery disease, myocardial infarction, or pericardial effusion? What are we thinking? Shout out to all 370 y'all. We are doing NCLEX questions. Make sure you guys smash that like button. You guys share and you guys follow. That is a trifecta. That puts me on the For You page. I need to be on everybody's For You page because you never know who this is going to help. So don't be selfish your whole life. And we're on the road to 20,000 likes. So let's make that happen. Let's make that happen. Also, I'll wait until I answer this question. I'll tell you that next part. But here we go. Got D. Okay, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A, cardiomyopathy. Right? Cardiomyopathy isn't usually related to underlying heart diseases such as atherosclerosis. The etiology is in most cases is unknown. That is part of reduction of risk potential. Essentially, the fourth largest section on the NCLEX based off of client needs at 9 to 15%. All right, 9 to 15%. Remember, hey, if you get this wrong, you got to, read your answer on why it's right. And then read the answer that you picked. As a matter of fact, read them all and see why those answers made this one incorrect. All right. So shout out to everybody who got this question right. All right. Here we go. Question number 8. Which of the following types of cardiomyopathy can be associated with childbirth? Is it dilated, hypertrophic myocarditis, or restrictive? What are we thinking? Hey, something else about me, y'all. I failed my NCLEX 3 times. I passed it on my 4th time. First time, 75. Second time, 265. Third time, 106. And then the last time it was during COVID. So I had 60 questions. Let me tell you something. No part of me cares about what you or anyone else thinks about the fact that I failed an exam. Guess what? You want to know why? Because my job didn't ask. My patients don't ask. My patients have never asked, period, at all whatsoever. The test doesn't determine what type of nurse that you're going to be. That's it. It does not determine the type of nurse that you're going to be. Only you can determine that, period. So get out of your own head. Get out of your own way. You see what I'm saying? Stop letting these people that don't know shit about you tell you that you ain't nothing for the fact that you ain't passed an exam for the first time. You see what I'm saying? Because guess what? It changes nothing. It changes nothing. All right. So here we go. Here's our answer. Is it Ishani? Look, I don't play the games. I don't play the games because I'm tired of people lying to y'all. Like, for real. I'm tired of people just like, oh, well, I would never want you to be my nurse. Well, it's a good fucking thing I won't be your nurse then, huh? It's a good thing. But guess what? The last thing you're going to ask me if you're sick is how many times you took the NCLEX. I guarantee it. So I'm just saying, here we go. The answer is A. Although the cause isn't entirely known, cardiac dilation and heart failure may develop during the last month of pregnancy of the first few months after birth. The condition may result from a pre-existing cardiomyopathy not apparent prior to pregnancy. Part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. I was in nursing school and struggled with the exam, withdrew in good standing, but those tests, they're wild. They are wild. They are wild. Remember, when you guys are answering your questions or reviewing your questions, you need to review why the answer is correct, and you also need to read the answer choices on why it's incorrect. That is part of the review. All right. That is part of the review. Kevin, you are one of the good nurses. Tell it how it is. And the empathy. I work in the site. That's what I'm saying. You have to be able to have something like that. You have to be able to be honest. I'll never lie to a nursing student. You want to know why? It's because all these other people will just be like, no, stop playing. Stop playing with me. Stop playing with me. All right, here we go. Question 9. A septal involvement occurs in which type of cardiomyopathy? Congestive, dilated, hypertrophic or restrictive. Now, here's something I will say is I've met nurses that have passed the exam the first time and they make horrible decisions. Just like I've met nurses who have failed multiple times that make great decisions. Once again, that test doesn't determine anything about how you are going to perform as a nurse. That's what I'm saying. Get out of your own way. Get out of your own head. For those of my repeat test takers that are out there, hey, I'm telling you something right now. Don't worry about what these people talking about. They don't know nothing about you. They don't know nothing about you. It's your compassion as a nurse. And you have to have compassion as a nurse. You have to have some type. And let me tell you something. If you start to get compassion fatigue while you guys are out there working, you need to switch it up. You need to switch it up. Like if you need to leave your department, you need to leave nursing altogether. You got to do something for yourself mentally. All right. But here we go. The answer is C, hypertrophic. And hypertrophic cardiomyopathy, hypertrophy of the ventricular septum, not the ventricle chambers, is apparent. All right. Hypertrophic cardiomyopathy is a genetic cardiovascular disease. It is defined by an increase in left ventricular wall thickness that is not solely explained by abnormal loading conditions. Shout out to the TikTok hat. I appreciate you. Who gave me that? Is it Mide or Mide? Hopefully I said that right. I'm so sorry. It is defined by, I already said that. This disorder is caused by a mutation of cardiac sarcomeres protein genes and is most frequently transmitted as an autosomal dominant trait. That is part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Once you guys understand what categories these fall under, what client needs they fall under, you will all understand what the categories and subcategories are. There's only so many ways you can write a question. There's only so many ways they can write a question. All right. So understanding the content and then practice. Doesn't matter how easy the questions are. You got to be able to put in the work. All right, here we go. Question 10. Which of the following recurring conditions most likely occurs in clients with cardiomyopathy? Is it heart failure, diabetes, mellitus, myocardial infarction, or pericardial infusion? What are we thinking? Hey, if you guys are new here, welcome. We're on the road to 20,000 likes. 20,000 likes. Make sure you guys smash that like button. You guys share. You guys follow. Also, if you're in nursing school and you haven't shared this, what are you doing? I'm going to need for you to fix yourself. All right. I got these questions off nurseslabs.com. They are free sets of questions. Free sets of questions. You guys can go over there and check those out for yourself. Also, if you're a nursing student, they got care plans over there, y'all. I used them. Other people used them. You know what I'm saying? It's not cheating. Some people are in nursing school and are so scared that, if you breathe the wrong way, they're going to kick you out for cheating. You can use them. Trust and believe me. All right. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A. It is heart failure. Because the structure and function of the heart is affected, heart failure most commonly occurs in clients with cardiomyopathy. Heart failure can occur when the heart muscle is weak or when it is stiff and unable to relax normally. Cardiomyopathy, which means disease of the heart muscle, is one of many causes of heart failure. That is part of physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. Client needs. Hey, if you ever want to know what how much it is, go to the National Counsel's website, ncsbn.org. It will tell you the percentages. All right. So peace. Thank you for that, Rose. I appreciate you.